Hello, America. My name's Kerry Malin. I am a family care practitioner in Spring Valley, Arizona, and I'm also the owner of Malin Medical. I wanted to do this presentation today to talk to you a little bit about affordable insurance for all people in America. It's a big issue, and I think, I watched a presentation on the news about our current healthcare reform plan and our government's plans for that. And I felt like the issue was missed a little bit as far as what's the big issue here. And I really think the big issue is that people cannot afford insurance. We need to create a national health care insurance plan that is affordable for all people. And I don't think that's really being addressed as well. You know, we had Obamacare and it basically expanded Medicaid. It did help provide a little more coverage, but even the people under the Obamacare plan have complained that the rates are too expensive, they can't afford it, so they don't, and they go without insurance again. This is a huge problem because people who don't have insurance, they're putting their health and their families at risk, and they're also helping to drive up the cost of health care. People will go into emergency rooms in hospitals and they don't have insurance and they end up having an appendix rupture or their gallbladder or a stent placed because of a heart attack, and they rack up bills in the $300,000, $400,000 range, which they simply can't afford. So what happens with that? We end up having to write off in the healthcare system billions of dollars every year because people can't afford insurance. So we all pay for that in the long run with higher healthcare costs, higher hospital costs and everything. And we need an affordable insurance plan. And I've come up with a template, an idea that I think will work. And that's what my presentation is about today. So it's a big issue, healthcare reform. There's a lot of issues involved with that. I don't have time to possibly go through all the different issues. The main issue that we need to address in America today is having insurance that's affordable for everyone. Now, we have multiple things in place already. We don't need to mess around with Medicare, with Medicaid. Those systems are already in place. We just need to formulate a plan to make insurance more affordable. And I think with this plan, I think it's fair. It would be affordable to everyone, and it's not going to infringe on the already existing insurance companies that are out there. So Aetna, Blue Cross Blue Shield, Humana, United, all the private insurances that are out there today are going to be maintained. The system's already in place for the Medicaid, the expanded Medicaid through Obamacare. There's already the system in place as far as the companies that are helping to pay out and to service that. What we need to do is take Medicaid. Now, Medicaid was originally designed as a temporary type insurance for people who are temporarily disabled or out of work or have no income. So we need to kind of shift Medicaid into the plan that I'm about to talk about now. And we'll just go with the tier one of the healthcare plan. Now, you can call this whatever you want. You can call it Americare, Americaid. It doesn't matter. It doesn't matter the name, but I might refer to it as Americare because it seems that's a good name. America cares for its people. Our government might have to look into that. I believe there is a company out there called Americare already with that, so there might be some trademark infringement rights that you need to address. But for the sake of simplicity, I'm just going to call this the Americare plan. And basically what this is that everybody must have insurance. And I know that doesn't set well with a lot of people, but really it's your right to have insurance. It's your responsibility. If we drive, we have to have insurance to drive. So if you are working and you're making a paycheck, then we can make it easy and affordable by making deductions straight from your paycheck and at an affordable rate. Now, what I've come up with is just a template. It's the percentages that I quote here and everything are simply a starting point, a template. Financial analysts and advisors with the U.S. government will probably have to take a look and say, well, will this really work at these percentiles? Is this going to, bankrupt the system? Again, this is a starting point, a template, but something to think about as far as getting insurance to everybody in America. So if you have a job and you get a payroll check, you will have a deduction coming out of that payroll check. We already have Medicare that comes out of our checks. We have FICA, state tax. So there's going to be one more deduction that is taken out of our payroll, and that's going to be for AmeriCare insurance, or whatever we're going to call this plan. It'll be a nationally government subsidized insurance plan for everyone. It will be, again, taken out of your paycheck at affordable percentiles for everybody so that you will have insurance. In your payroll, you will either choose to have AmeriCare as your insurance plan, and the deductions at the percentiles will be taken out based on your income. Or if you already have an existing insurance through your employer, or you're already paying for some other type of insurance policy, we just plug that insurance name and policy number in, and zero deductions get taken from your paycheck. So the income levels between $5,000 and $50,000, I think, are the hardest hit in America today because they simply can't afford any other insurance. Obamacare created an expanded type of Medicaid that allowed people to get Medicaid at lower levels, and then expanded it to for Medicaid, and then you pay into the system in addition with the Obamacare. But even those patients were paying $600+ a month, and they simply couldn't afford to, so they chose to go without insurance and take the ding on their taxes instead of having insurance, which again, I think it's your right and responsibility and safety for your health to have some type of insurance. If you are not employed, if you are disabled, if you're retired, we already have those systems in place. Medicare takes care of the elderly and retired. Medicaid for those who are disabled. And Medicaid also supplements Medicare if they have no income, or their income is too low for them to even afford co-pays and stuff. So we don't need to mess with those systems. Those systems are already in place for our disabled, or people who have no income. And this way, this will encourage people to work. Now, there are some people that they don't want to go out and work because they're afraid they're going to get kicked off their Medicaid plan, and then they won't have insurance. So our current system is stifling growth in America for employment. So, if you have a plan where if you have a job and the money comes straight out of your paycheck, then that encourages people to work. And I think people really want to work and be able to make money and help have a better life for their families. So the tier 1 level, again, the hardest hit are the people in the price range $50,000 to $50,000 for their annual income. Anybody who's making less than $5,000 is not making a reportable income anyway, so we're just going to start with $5,000 as the start. Now, from this tier category, it's going to be set up just like Medicaid is set up right now. We already have all the insurance companies taking care of it and in place, and they can just roll over. And now, instead of zero income coming into the Medicaid system, we'll have at least something coming in. So, again, in this tier category, the lower income people, they can't afford the big co-pays, the cost of medications for their co-pays. They can't afford going to the doctors and having co-pays. So just the way Medicaid is set up today, there's zero co-pay for office visits, zero co-pay for formulary and generic meds. But I think that we need to make some adjustments in this and say, for ER visits, anything that is free of charge and unlimited access, it's going to be terribly overutilized. So I think in this, it would be fair to say something like a $15 copay for an ER visit, and then encourage them, the patients, to go more towards urgent care where they would get a $0 copay. So for the people, again, these brackets that I have set up here, This is a template. This is not meant to be, hard in stone. This can be looked at by the financial analysts and everything with our government to see if this really would work. But I think this is pretty close, and this will give us a good starting point to work with. A plan like this actually could be implemented very quickly through HR and payroll systems, and we could have a system like this set up within a 6-month time frame easily. The people who make $5,000 to $25,000, so people who are making $10 an hour, that's in that pay category, they cannot afford a large amount coming out of their paychecks. So starting at a 2% deduction, and then you tack on 1 additional percent for each dependent that they may have, again, max that can be taken out is 5%. So a single mom with 3 kids making $20,000 a year, and she has for the insurance for herself, it's 2% plus an additional 3% for her 3 kids, so she's paying 5% of her $20,000. That's $1,000 a year, and it sounds like a lot, but in perspective, it's less than $100 a month for her and her 3 children to have insurance under this plan. And it will be, again, taken directly from the paycheck, and at that level, I don't think it's going to cause too much financial distress. The next is $25,000 to $50,000. And at this, I think we should start at a 4% rate, and then again, tack on 1% for each dependent, and again, max 5% can be taken out of your paycheck. And this way, people who are married and they both are making $10, $15 an hour, then it will be deducted for the primary person who's on the insurance policy, plus you tack on the dependents until you reach the max 5%, the same way we did here. So that would mean that there would be 2 people actually paying 5% out of their paychecks for coverage for their family and their dependents. So again, the max 5% from this income level of the people in America. So this, again, Medicaid was designed as a temporary disability type insurance. If you get into an accident, if you have a surgery and you're out of work for 6 months, that's where the Medicaid program should help and be there to help support our people. But right now, we need to take all the people who are having income, they're making money out of the Medicaid system, and shift them into the Americare type insurance care system. Obamacare, that will be also deleted, because Obamacare was an expanded form of Medicaid, which basically made people pay premiums and stuff, monthly premiums for a Medicaid type insurance, because their pay level was above the actual Medicaid lowest level. So that will be taken out of the picture, and everybody will be switched into the Americare government subsidized insurance plan. So this would be the tier 1. Again, this is the hardest hit population in America. This is probably some of the largest population, and this would help provide insurance at an affordable rate for everybody in this pay range. Now, people who make $50,000 to $100,000 a year, they're going to pay a little bit more. So the maximum deduction in this pay category would be 7.5%, and that sounds like a lot, but again, if you're making $100,000, 7.5% of that, $7,500 a year, gets taken out of your check for insurance. That's less than what I've paid for insurance in the past. I've actually paid up to $1,800 a month for insurance through various insurance plans. So again, if you already have an insurance, you're employed, your employer takes care of it, you don't even have to worry about this. You plug in Aetna, Blue Cross Blue Shield, Cigna, or whatever insurance you have into your payroll, and 0 deductions will come out of your check. You already have insurance, you're covered. If you don't have insurance and can't afford it, at $50,000 to $75,000, again, this is a template. I'm suggesting maybe 6% gets taken, and then 1% for each dependent. Max 7.5% comes out of your paycheck on an annual basis. The $75,000 to $100,000, cut it at 7.5. Just everybody in that category will pay 7.5%. So this also enables you, if you think that you can go out and find an insurance policy, a commercial insurance policy for less than $7,500 a month, you're more than welcome to go do that. It helps preserve all the existing insurance companies, so they don't have to panic about this. This tier level 2 will have kind of like the expanded Medicaid type setup, where you will have some copays for office visits. You'll have like a $10 copay or $20 to see a specialist, $25 copays for ERs, and some of them are $50 at this point. $10 for urgent care. I think those are fair copays for this income category of person. $5 copay for generic meds and meds that are on formulary. If a medication isn't on formulary and gets prior authorized, $10 copay. And then for all radiology images like x-rays, MRIs, CTs and that, $20. I think that's affordable. People can afford to pay this level of copays when they're making this level of money. So again, the existing programs that are under expanded Medicaid, United Healthcare, there's a lot of different insurance policies that are already servicing this type of patient. So there's not a lot of extra stuff we have to do. We just need to make sure that the payrolls get taken out, the deductions, and then either the government will have to decentralize the subsidize and make it state responsibility, or they take on the entire thing for a Medicare insurance plan themselves. The final one is the pay grades from 100 to 250,000. I stopped at 250,000 because at this level you're going to get 10% deduction to have a Medicare type insurance. So if you are at 250,000, that's going to be 25,000 taken out of your paycheck for insurance. And I'm pretty sure you can probably find a more affordable insurance plan through one of the privatized insurance agencies. But if people choose at this level to still go with the Americare because they think that it's easier, and especially in the lower $100,000 range, they're only going at 10% of, if you're making 150,000, that's 15,000. Well, there's a lot of insurance policies out there that are more expensive than $15,000 a year. So every individual will have to take a look at it themselves and say, okay, do I want this, or do I want to go with Cigna or Blue Cross Blue Shield, Aetna, one of these other ones? Again, the commercial insurance, it varies greatly in as far as the co-pays, office visits and stuff. I'm not even going to try to go through and make sure that all these things are going to be addressed, because most likely that this tier level 3 will be taken care of privatized insurance companies, and they're already going to have their co-pays and everything worked out. But the typical that we see is $5 generic and formulary meds, and then they go into this tier copay, $20 for branded or $35 for branded name. So this will be set up, tier level 3 at this income category will be set up just like a commercial type insurance. So that's the plan. And I think it's very workable and it's easy to implement. It's a matter of just contacting the HR system, the payroll systems, and having the money deducted from the paycheck. And then that way everybody who has employment and who is working will have insurance also. So that was the insurance plan proposal that I've come up with. I hope that this message gets out. I hope it makes sense. I hope that we can implement some kind of plan that's similar to this. It doesn't have to be the exact same percentages, but again, I feel strongly that everybody must have insurance for their own safety reasons. The final thing I would like to talk to you about today would be, and this is way off the subject, but it's a personal passion of mine. I would like to ask President Trump to please try to abolish the IRS. This system was created years ago by some congressmen and senators in Ohio. It's an antiquated system. It's utterly ridiculous that we have to scurry around at the first part of April to try to get everything, our deductions, everything in place by April 15th to submit our taxes. And to try to squeeze more money out, we have to oftentimes hire tax consultants, tax attorneys. This system is set up with a bunch of waste. We're wasting billions of dollars every year on this current IRS setup. I think a graduated tax system based on lower tax rates for lower income people, and if we know that the lower income tax rate categories are getting $3,000, $5,000 back every year, then why don't we just lower the tax a little more so we don't have to worry about money coming back? You set it up the same way as this. If you have somebody who's making $20,000 a year, 2%, and then if they have dependents, maybe take a 0.5% or more. Some kind of system that's a graduated tax system based on income, and it's flat tax rate. Everything, the same rate gets taken out for the same income category. And then you take a little less out depending on how many dependents they have in their family, and that's it. You get the taxes taken out every year, and you don't have to worry about filing income tax checks or income tax reports. You don't have to worry about paying some of the tax consultants. I think it's just a big waste of money. Just cutting the checks alone wastes probably several $million every year that can better be utilized for taking care of our American people. So President Trump said that he wanted to make America great again. So let's make America great. Let's keep them healthy, and let's get rid of the IRS. The other thing is that, for the upper income, I think that there should be a cap limit on tax. We can still, have corporate taxes and everything, but for the individual tax to come out of every individual, I think the max should be 10%. I'm expected to give 10% to my God and my church for tithings, but yet I'm expected to give more than that to the U.S. government. It doesn't seem fair to God. So, I think a reform of the entire IRS system is needed. I think that, the people that are currently in the IRS could be utilized in an AmeriCare type plan, let them manage the monies coming in and figure out how to better manage the medical care system instead of worrying about taxes. The IRS agents that are there already to help police and take care of corporate tax and all that, sure, keep them on board, but we're not going to need so many IRS agents if we have a graduated tax that is a flat rate set and no income tax coming back at the end of the year for all people. I thank you for your time today. This message has been brought to you by Malin Medical, experienced healthcare from the heart.